me start by asking you about the changing advice we've had at federal level, the CDC changing its guidance then in the US with regards to testing. And if you've been exposed to a case of coronavirus, but you're asymptomatic, the guidance is now that you don't test. What do we know about asymptomatic transmission that we need to understand when evaluating this change?
Yeah, well, to be honest, this is a bit of a head-scratcher to many of us in the public health field. We know from data that asymptomatic infected individuals are responsible for a large amount of the virus spread in the U.S. and globally. So the new CDC guidelines sort of de-emphasize testing the population that we think is incredibly important in terms of the spread of the virus. The reason we recommend wearing masks is to limit asymptomatic individuals from spreading the virus. So it's still not clear what science is truly driving this recommendation. It certainly does seem to be counterintuitive to many public health individuals.
And one of the other things we've learned a bit more about this week, Andrew, is around reinfection. There's been a much reported case in Hong Kong where we've learned a bit more about reinfection. Is that really the only case, though? And if it is, does that suggest that reinfection is not very usual? It's fairly abnormal. I mean, what do we know about the risks of reinfection now?
Yeah, so the Hong Kong case has been well characterized. It's a very unique case in that they were able to have samples of this individual's nasal swabs from their first infection as well as from a second infection. And it was some intensive screening at the airports in Hong Kong that allowed for them to capture this person's second infection. It seems like the second infection was asymptomatic, so the person wasn't suffering any symptoms. What's still unclear is whether or not that person was able to transmit virus from this second infection. There are now two other cases, one in the Netherlands and one in Belgium, of similar situations. So we're just starting to scratch the surface of what reinfections are happening and what we'll call pathogenesis is. It's an incredibly important topic because we want to know how long immunity from an infection and from a vaccine will protect us from reinfection. But it's also important to know that even if you're infected, you'll probably get some more mild symptoms. The question that we need to answer is, even with those mild or asymptomatic infections, can you spread the virus in a reinfection? Because that's going to affect all of our public health interventions right now.
Yeah, and Andrew, what clues do we have from other viruses, if they are at all relevant, as to whether it is likely that you can spread on a second infection? I mean, why would you not be able to spread on a second infection in the same way as you spread on a first?
Yeah, so we know with some viruses, and I'll use influenza as an example, that when you get infected, you have some pretty strong immunity that prevents you from being infected a second time. We also know, though, from work on the common cold viruses, which cause a very mild disease in humans, that there the immunity from reinfection lasts only for a small period of time, and you can get reinfected and in some cases even shed infectious virus, which is a surrogate for your ability to spread infections. So because so many of these COVID-19 cases are mild, we tend to look to those common cold viruses in humans for examples of what immunity and reinfection are going to imply. And that's why our concern.
And Professor, as we see a lot of communities sending their children back to school, either already or will do shortly, what do we know about symptoms in children? I think there's been some work here in the UK that suggests that we might see slightly different symptoms of the virus in children, which we need to all watch for, I suppose, if we're sending our children back.
Yeah, absolutely. It certainly seems like for the vast majority of children, symptoms are much more milder than you see for adults or the elderly. They are able to produce virus. They are able to shed virus. And so transmission within children and from children to adults is really the area that is now our primary focus, because that's going to tell us much more carefully about the spread of virus within school communities and those kind of things. We certainly know from cases here in the United States at universities that spread of the virus in young adult populations can occur very, very easily, and you can see that from multiple universities here that have tried to open up and have then subsequently gone to just completely online learning because of the spread of virus during those first few weeks of them being open for on-site learning. We need to go to the younger population and understand that there.